Across Nigeria are facing severe disruptions as members of the National Association of Nigerian Nurses and Midwives embark on a 7-day warning strike. The action comes after the expiration of a 15-day ultimatum to the federal government. From Lagos to Abuja, patients have been turned away from outpatient clinics, appointments cancelled, and services slowed to a crawl. The situation is worsened by a simultaneous strike by the Medical Guild in Lagos over salary deductions. The union cites long-standing issues of poor working conditions and unmet welfare demands. At the heart of their protest is a June 27 circular from the National Salaries, Income and Wages Commission, which they argue fails to address critical concerns affecting the nursing profession. With patients bearing the brunt of the standoff, there are growing calls for urgent intervention to restore services and begin genuine dialogue. Asuku, I'll start with you. Nurses going on strike, really scary, but try and unpack this for us. What are the key demands of this striking nurses? Are they centered around salary, working conditions, or just regulatory issues?
Well, it's very sad that we've come to this particular junction, because I was thinking that we have gone past medical workers going on strike because of how important they are. Sometimes it's the doctors, but now it's the nurses.
The nurses.
Now the doctors cannot function
without the nurses, absolutely.
And now the doctors are also complaining that even if they want to even help patients, they are on duty.
Yes.
They need the nurses to do the running around, picking one or two things.
They give them drugs. They even give emotional support to the patients.
Who is going to bring your file? Is it not the nurse?
Absolutely.
Who is going to move you from one particular point to the other? Is the nurse. Bringing patients to the doctors is the nurse. So there's a lot.
They do a lot. They do a lot.
So I was thinking we would have gone past this, but the nurses are also complaining. And I know one of the major complaints has always been that they are not enough. We don't have enough nurses. Because most of the nurses that we have, some of them have jackpot. They left Nigeria because they feel that the welfare here is not commensurate with what they are doing. Nobody is even listening to them. And so the best thing is they will go to other countries where they will really appreciate their efforts. So when nurses live like that, it creates a vacuum.
True.
And in that vacuum, we are beginning to have that problem now. So imagine a nurse one nurse taking care of maybe 30 patients from morning, then another set of patients will come from morning till night, just like that. So it becomes a big burden. And then the thing is, nobody is telling them, okay, if you work that 24 hours and add another 24 hours, there will be maybe allowances for you.
Are they paying them overtime?
There's no
hazard allowance.
So those are some of the demands that they are making. So another demand they are making is sometimes doctors get to the level of becoming directors. But there's no nurse. They are a professional organization.
Absolutely,
too.
They are.
But nurses they are not moved to the directorial level.
So they have a glass ceiling.
So they just have that. So once you get to a particular cadre, that is the end. You are just then from there you're
retired.
You retire.
Oh, no.
So they are now begging the government, and that was why they said they wanted to talk to the government. Let's sit down. Let's see how we can make our profession become a full profession like that of the doctors.
Exactly.
And that of every other profession.
Absolutely.
If I'm a nurse, I want to at least one day become a director. Because we have CMDs who are doctors. Most of them are doctors. So imagine a CMD of a federal institution is either going to be maybe a gynecologist,
a surgeon,
and all that. They will move the doctor to become CMD. But a nurse will still remain a nurse.
No.
Be giving patients injection, and that's all you should be doing. Taking care. No.
And what they do, the doctors cannot function without the nurses.
Yes, of course. And the thing is, the nurses also do some professional courses that make them to almost get to that, to that managerial level.
Absolutely.
So I think it's something the government can look at. It's not something they can just wish off, you know, but something they can just look at and see how they can
looking at this,
on
this matter, how long have these issues been building up? You know, and what efforts do you think have been made, you know, to either negotiate, to have talk with them? I mean, before the nurses said, enough is enough, we're even going on strike.
We've always had it. But the first thing I saw when I checked, nurses make up between 60% and 70% of our medical workforce.
60%?
Yes, yeah, to 70%, meaning that they are core.
True, they are.
To whatever operation we are running. Now, one of them said something that I found rather unbelievable, but when I went through their demands, I found it to be true. That more than 90% of their demands are not about money.
No.
Not about money.
No.
Not about money. These are the things we agreed on. These are the things the courts have ruled on. Implement them. That's all. So if it's about money, we'll say,
okay, maybe
where do we
increase
get the money or not? But gazette some things. Let it be institutionalized. Let us also have a sense of belonging within the medical profession, so that we can also feel like a human being.
Absolutely.
You know? Because some say the hospital can function without a doctor, but it can't function without
a nurse. I agree.
They say so, and I agree with them. Because the doctor can, who is used to a patient, can call the nurse on the phone
call the nurse and
do
then
this.
Prescribe this and this.
But the nurse cannot tell the doctor this, especially some of them, you find out they are even scared of giving injections and say, yeah, doctor, give this injection. I know of doctors who run away from taking injections themselves.
Yes, they don't.
And also, nurses are the only ones that recognize, they can recognize the rights of doctors. Because the rights of doctors.
So the chairman of the Cross River State chapter of the National Association of Nigerian Nurses and Midwives, he listed some of these things. And I think it's worth talking about. He said they want gazetting of the nursing scheme of service.
Okay.
That is, institutionalize this as scheme of service. Make it, I mean, something that somebody can go into the records and see. Not that we are just...
But some might want to ask that the demands of these nurses, are they realistic?
There is nothing unrealistic. That's why I'm taking time to go through them. They said you should have a department of nursing force in the Federal Ministry of Health, like the doctors have. Let there be somebody who is overseeing a matter directly. Not that we want to talk about something and we don't have a director that we can go to. They are saying centralized internship for nursing graduates, just like we have done with the doctors. Review the provisional allowances for nurses. This is not about adding to the salary. And I think that's the area where I've seen money coming out of all of it. And then appoint nurses to the boards of federal and state health institutions. I
think these are genuine concerns which the minister should actually look into.
Then bring in more people, like you said, shortage. You have nurses who are PhD holders. Yes. Do you know there is PhD in nursing? And some of them are PhD in nursing. So it means...
And yet they can't get to that. Can't get to the pinnacle. There's a glass ceiling there.
You know, it was just like what used to happen in the Nigeria police. Once you are part of the traffic control, you can't, there is a ceiling. You can't go beyond
like a traffic control. You want to get to commissioner. How?
You know?
They need to.
But don't forget, some of those people who are doing this traffic work are also very qualified. They're very qualified, but okay, what is available now? Let's do it. And that's why you saw that in the police something was moved. Let's raise the bar.
Sure.
You can't stay at one point forever in their lives. And I completely agree with them. They need some of this.
But also here in Lagos, the doctors are also on strike. They said their money is being deducted, 30,000 to 300,000. I mean, how did we get here?
No, maybe it's going to be a system issue because I know that a colleague of mine was even, complaining that they're on strike some 3 days back. I was wondering because he actually took his wife to the hospital in last week.
Yes.
So I was saying, what is the problem? Because last week they hardly go on strike except it's general. He now said salary deduction. So in my head I was like, how can you deduct?
Yes.
the doctor's salary. But doctors are not enough. If you go to that, they are not enough.
Because most of
deducting their salary.
And you still deduct, and not just any small amount. It's a big chunk, big chunk.
So I think it's something the state government, and the thing is, the state government have not really come out, firmly to tell us why it has happened. But I want to believe it's just a system issue that they can easily address.
Absolutely.
And sometimes I feel that we shouldn't rush, to go into strike. Because
they should be the last thing.
It should just be the last option. Because, for instance, I'm not sure the Lagos state government is so insensitive not to, sit down with the union, to the guild, to see what really happened and how they can solve that problem. Going on 3 days strike, do you know how many people would have died?
Absolutely.
So I think it's something they should have, addressed without going on
Now,
strike.
in looking at this, we heard that patients were turned back. The critical matter now here is how are the patients and the families, particularly those needing urgent and critical, especially in the rural areas, how would they cope?
That's why when some of these things happen in our own climate, some foreign countries are quick to say, like the US did about some days ago, medical services fail in Nigeria. People go on strike needlessly. That's why they look at us like we're a jungle. Because these are not things that ought to happen. In a situation where we are still complaining that people can't afford the services, you are now even going on strike. Because most of these, public hospitals are where people go. Because when you go to the private, you are going to pay through your throat. There is no way you are going to go into a private hospital now that you want to treat malaria that won't have 20,000.
Yes,
absolutely.
Exactly.
Absolutely, absolutely.
And that's why you hear that malaria kills more than even any other disease in this country. So we shouldn't even allow things like this to happen. And the government, too, should be proactive. It is not after they've gone on strike.
That's
the
when you now call them to the table.
Come, let us dialogue. Please suspend this until when we are ready. It shouldn't be. I'm not saying the ministers are not doing well, but they can do better by preventing some of these things from happening. I loved what the education minister said. That's Dr. Tunji Alausa. Okay. That the mandate that they have from the president is lecturers must not go on strike. Whatever you must do to ensure these people remaining, it's fine. Let's do it.
And I'm sure that mandate would have been forwarded to the Minister of Health as well.
Yeah, that's
that doctors, nurses must not go on strike.
That's the way we should approach these things. And when you look at what they are clamoring for, it's just for you to gazette. Why are we finding it difficult? For how many years now have we been battling with this disparity between BSc and HND? How long?
The dichotomy.
A president says, this is the endorsement. Go ahead and do this. Who are those who are stopping it? The court has ruled. You have not obtained a counter ruling. And you are not implementing what the court has said. Those are just the basic things we can see in this.
Absolutely.
Strike. Except the nurses are not telling us the truth. But nobody has come from the government to counter them.
Yeah.
Meaning that those are the issues.
I think the government needs to sit down with them. Because they are very vital.
And they are not asking for too.
They are not.
They're not asking. They're the basic things.
It's just basic. There was even a time they were, nurses were on strike because of the issues about their certificate and all that. After finishing, they will now tell you to stay for another. So many things concerning the nurses. But right now, it's not even about certificate. It's about condition of service.
Implement these things.
You understand? Just implement. And there are simple things that the government can sit down and then just make sure that they implement.
Absolutely.
Because people are dying. The more nurses remain at home, the more they overstretch the doctors, and the more people will die.
Yeah, we're even talking about.
Is it the doctors that will give emotional support?
But we're even talking about 70% of the workforce, medical workforce.
That's 70%.
Jobs, 70%.
Because the doctors can even be like maybe 20.
Exactly.
It may not be even up to, because you are talking of physiotherapists.
Exactly. So other things
are there.
So making 30.
All right, gentlemen, we need to go on this quick break. And when we return, the conversation continues. Don't go anywhere. Still Journalist Hangout. All right, if you just joined us, it's still Journalist Hangout. I still have Dr. Oladipo Roy here with us, and Asukwa James still with us on the show, Journalist Hangout. Now, moving on straight to our next conversation. Access to health care begins with proximity, and proximity begins with primary health. In the past 2 years, the federal government has disbursed over 20 billion naira to 4,362 primary health centers across 19 northern states and the FCT under the Basic Healthcare Provision Fund. Coordinating Minister of Health and Social Welfare, Mohammed Ali Pate, shared the update during a government citizens engagement forum in Kaduna hosted by the Sir Amadu Bello Memorial Foundation. According to a release by Rabi Ibrahim, media aide to the Minister of Information, the support extends to 274 executed projects across 35 tertiary hospitals. Health experts maintain that revitalizing public health centers is a vital step towards reducing preventable deaths, improving maternal care, and achieving universal health coverage. With millions of patients already reached, the government says the intervention is only the beginning of deeper reforms in this sector. Okay, Dr. What specific goals does the 20 billion naira disbursement aiming to achieve, with these primary health centers?
Well, despite the fact that there is a larger target for the release of this information,
yes,
but we can first narrow it to that of the health sector.
Okay.
Now, we know that the health sector is in stages. You have the primary, you have the
secondary, and the tertiary.
And the closest to us
is the primary health centers.
So, once you don't fund them, once you don't have enough men to man them, then you have created a problem. And that problem is going to go up to the secondary, clog that place up, and move on to the tertiary. Because sometimes you see people come to the tertiary level to treat things that are not, so serious. Because the primary health centers are not functioning.
Absolutely. All right, just hold that thought. Asukwa, now it is 20 billion naira. We need to look at transparency. Because how will the government, or maybe there be agencies to ensure that these funds are not misappropriated? This is money we are talking about.
Well, I know that the minister that we have is a very thorough professor, so he would not want to soil his name. So they would have done their, they would have put structures in place, so that when these funds are being, sent to the 4,000 primary health care centers, it gets directly to the primary health, and they will be able to support the local government in that area. Now, people will be saying, why 20 billion? Why 20 billion to this primary health care center? After all, the local government, they are the ones that are supposed to handle. But there are some things, and there are some local governments who might want some other things that is beyond them. And it's just a support. Okay. It's not that the federal government is taking that role. Okay? The major role, or the major harm of government, or the major arm of government that is supposed is the local government.
Absolutely.
Is the so it means that when I was coming, I was thinking, why is it that local governments, all local governments in Nigeria, why is it that they cannot build correct primary healthcare center? And I've seen some local governments in Lagos, but I believe that they can do that in each ward, whereby when one local government primary healthcare center should be some places that people can easily go.
Exactly.
Imagine you have malaria. Instead of going to the primary healthcare center, you are going to the general hospital. You shouldn't. Because you say, oh, God, this headache, I've been using paracetamol. It's not going.
Some don't even go to the hospital. They go, oh, anti-chemist.
And you understand? So at the end of the day, they will just feel that because they couldn't, there's no good primary healthcare center. Because some people feel the primary healthcare center in some places is only for maternal care. They've forgotten that primary healthcare center can also treat other
malaria, exactly. Everything.
So when you go there, there's a doctor. So that is where some of this money will getting a doctor on ground in primary healthcare centers, making sure that they have even the minimal equipment.
Exactly.
Okay, to treat different common illnesses, you know, that will come up.
Yes.
And also buying medication. Because when they have all those things, you know, it would stop people from going to general hospital or the tertiary institutions.
Exactly.
You know, hospitals, you know, for them to be able to get, you know, treatment. Proper treatment. So I feel that this money, if they are, you know, well used and followed, like I keep saying, follow the money. It's not just about sending 20
accountability.
billion.
We need to monitor.
It's not about politics because some people have already said, because they are already talking about the North. That's why they are. It is something that is already on ground.
Exactly.
They've already budgeted for it before, you know. And I feel that even the disbursement they're even waiting for the disbursement for the Q1 and Q2. You know, so it's something that the government wants to do for the North.
All right, Johnson, let me come back to you. Now, with this huge intervention, or should we say injection, because we're still talking health, maternal and child care, child immunization, disease surveillance. With this injection, all of this should improve in the North, especially in the rural communities in the North. It should improve, right?
I agree with you, it should. And that's why the aspect of the politics of it, we must begin to also talk about it. Because you'll notice that on this program we've been talking about it, especially BKO.
Yeah, okay.
That when those who are in charge of our ministries, especially at the federal level, when they don't talk about what the government is doing,
yes,
then they don't deserve to be in that office.
Absolutely. Exactly. I agree.
Because it is only when we know that we can follow the money.
Exactly.
When Nigerians don't know what is being done, how do we follow the money? How do we ensure that, okay, they've told us that you should have this in this place. Where is it?
Where is it?
We should have so number of doctors in this place. Where are they? It's only then we can begin to ask questions. And because it's shameful, like we said, you mentioned maternal, you know, even this basic one that we have said, malaria. The last report we had from the World Health Organization, which I also think can be exaggerated, is that about 532 persons die of malaria in Nigeria daily. And that, for me, is not a good figure, especially when the government is spending this much. So we must also say it out. This is what we have done.
Sometimes I wonder why the ministers, they are not talking.
You know, like you said, this thing came out some 2-3 days ago, and we are hearing this. Did you read also of the number of roads that have been constructed by this administration? And that's why we keep saying, see, you may have the Minister of Information, but there is so much to what he alone can do. His ministry.
Yes.
There is so much to what he can do. We have the National Orientation Agency, which is doing well now.
Exactly.
But there is so much he can do without this information coming in. So we need people to start talking to us. Let us even be able to challenge those who are in charge. In some parts of Lagos, some riverine areas,
yes,
you still don't have so much happening there.
Exactly.
Where are the local government chairmen? And the governor told us some days back that for years, Lagos has been giving all funds
to the local
government. So we should have all of this information. These local government chairmen who have just been sworn in Lagos now, we should be able to take them to task.
Yes.
Because we know what you get. If it is a lie that the governor has told against you, come and say it to us.
Absolutely.
The governor told lie, oh, that's why we can't build this, we can't do this, we can't do that. But for us to now get to those basic things, and we still hear that people are dying while giving birth, it's a shame in this country.
So I see,
it's a shame.
For that of Lagos,
It's a shame.
because of how Lagos is, I do not want to believe that local government areas in Lagos, they don't have permanent healthcare centers that are functional.
So many of them.
All right.
functional.
I apologize. We need to go on this quick break, and we'll be right back. Don't go anywhere. Still, journalist hangout.